We've always been told that routine checkups were the gold standard of prevention. But what if we told you that after the age of 70, some of the most common medical tests might actually do more harm than good? Behind closed doors and buried in the footnotes of medical journals, studies have quietly revealed that some health screenings, often performed out of sheer habit, may trigger a chain of unnecessary anxiety, invasive follow-ups, and even irreversible damage in seniors. Most people don't know this. In fact, a vast majority of seniors over 70 are still undergoing tests that have been scientifically shown to offer little to no added benefit, and in some cases, can increase the risk of complications. One of these tests can raise your chances of complications by up to 35%, even when you are perfectly healthy. And the number one test on this list, it could land you in the emergency room by increasing your risk of a collapsed lung by over 25%, even if there's absolutely nothing wrong with you. Now, to be clear, this video is not personal medical advice. These insights are for educational purposes only. Always have a conversation with your trusted healthcare provider before making any decisions about your screening schedule. But everything we will share here is based on solid research, real-world examples, and important risks you deserve to understand. Before we dive in, we'd love to hear from you in the comments below. Have you or someone you care about ever had a test that led to more stress than solutions? And what's the one test you feel really uncertain about? We're reading and replying to every single comment with helpful insights. So please share your thoughts. Now, let's get started with number 5. Number 5, the carotid artery ultrasound. This test is frequently offered to seniors as part of a stroke prevention package. It uses sound waves to look for any narrowing or blockages in the carotid arteries, which are the major blood vessels that carry blood from your heart up to your brain. On paper, it sounds incredibly smart. After all, strokes can be devastating, and early detection seems like the obvious path to prevention. But here is where things get tricky. When this test is used routinely in people who have no symptoms, especially those over 70, it can become a serious problem. That's because the test often finds minor plaque buildup that isn't causing any issues and poses no immediate danger. However, once something is found, the next step is often aggressive intervention. This can include risky procedures like carotid artery surgery or stenting, which are operations that come with a significant chance of complications. According to a large-scale study published in JAMA Internal Medicine back in 2014, for every 1,000 seniors who received a carotid ultrasound without having any symptoms, only 3 had a blockage severe enough to actually warrant surgery. But nearly 60 of them were referred for further testing or procedures that caused unnecessary stress, financial costs, and in several cases, caused a stroke as a complication of the intervention itself. The U.S. Preventive Services Task Force, which is a leading group that evaluates screening tests, explicitly recommends against routine carotid ultrasounds in people without symptoms. The reason is simple. The risks of false positives and the cascade of unnecessary follow-up procedures far outweigh the chance of catching something serious in time. That said, there are specific situations where this test is very helpful. If someone has experienced symptoms like sudden weakness on one side of their body, difficulty speaking, or vision changes, which are signs of a transient ischemic attack or a mini-stroke, then a carotid ultrasound can be life-saving. In that case, it helps doctors plan a treatment to prevent a major stroke. But for a 75-year-old man who simply wants a routine check, the test could open the door to far more harm than good. Consider the story of a retired postal worker, 76 years old and enjoying his newfound freedom. He was feeling great but decided to get the ultrasound at a local health fair. The scan showed moderate plaque, and the doctor on site urged him to see a specialist, who then recommended a stenting procedure. During the recovery from that very procedure, he suffered a small stroke. It left him with slurred speech and weakness in his right arm, a life-altering event that likely never would have happened if the initial screening test had been avoided. Instead of a routine ultrasound, the better path is focusing on lifestyle improvements and diligent blood pressure monitoring. Those actions reduce stroke risk far more effectively than any scan, And when symptoms appear, that's the moment when testing should be initiated, not before. Let's now move on to the next one. This may surprise many of you. Number 4. Routine vitamin D testing. It sounds completely harmless, doesn't it? Just a simple blood test to check your vitamin D level. In recent years, vitamin D has been marketed as a miracle nutrient that supports bone health, immune function, and even brain performance. So, testing for it seems like a no-brainer, especially for older adults who may not get as much sun as they used to. But here is the catch. For people over 70 who are not showing any symptoms of a deficiency, routine testing rarely changes anything for the better. Worse, it often leads to oversupplementation, which brings its own set of serious health risks. According to a 2020 study published in the New England Journal of Medicine, more than 40% of seniors who tested low on vitamin D had no clinical signs of deficiency at all. And yet, most of them were placed on high-dose supplements. What happened next was alarming. Among seniors taking over 4,000 international units daily, the risk of developing painful kidney stones increased by 23%, and rates of hypercalcemia, which is a dangerous overload of calcium in the blood that causes nausea, confusion, and even heart rhythm problems, jumped by 18%. The problem is that vitamin D levels can vary widely depending on the season, the lab method used for testing, and even your hydration status on the day of the test. That means someone could test low in January and perfectly normal in July without doing anything differently. These natural fluctuations are often misinterpreted, leading to a cascade of interventions that are simply not necessary. Routine testing also doesn't predict fractures as clearly as we once thought. A large 2019 meta-analysis published in The Lancet reviewed over 80 randomized trials. It found that in seniors without any symptoms or major risk factors, vitamin D supplementation did not significantly reduce the risk of fractures or falls when compared to a placebo. Now, there are certainly cases when testing is warranted. If someone has diagnosed osteoporosis, a history of frequent falls, or specific signs like chronic muscle weakness or bone pain, then checking their vitamin D level makes perfect sense. It helps guide targeted treatment. I'll never forget reading about a woman, 81 years old, who went to her doctor feeling dizzy and tired all the time. The doctor immediately ordered a vitamin D test, which showed a slight deficiency, and he prescribed megadoses. But a week later, she was hospitalized with severe nausea and confusion. Her calcium levels were dangerously high. It turned out her dizziness had absolutely nothing to do with vitamin D. It was a side effect from one of her blood pressure medications. The vitamin D test created a dangerous distraction, not a solution. The better approach for most seniors is to assume they may benefit from a modest daily dose, somewhere around 800 to 1,000 international units, without needing blood tests unless specific symptoms arise. This way, you avoid the trap of overtreatment while still supporting your bone health. Now get ready, because number 3 is one of the most debated and misunderstood tests for older men. Number 3, the prostate-specific antigen test for men over 70. The PSA test is one of the most controversial screenings in modern medicine. It measures the level of a protein in the blood that is produced by the prostate gland, which is a walnut-sized organ that sits just below the bladder in men. Elevated PSA levels can sometimes indicate prostate cancer. But what most people don't realize is that a high PSA can also result from benign or non-cancerous conditions like prostatitis, which is an inflammation of the prostate, or benign prostatic hyperplasia, which is a very common age-related enlargement of the gland. For men over 70, this test requires even more careful consideration and a weighing of the pros and cons. That's because prostate cancer in older men often grows so slowly that it is unlikely to ever cause symptoms or shorten a person's life. But once that PSA test number comes back high, biopsies usually follow. These procedures can be painful and carry risks like infection and bleeding, which are more significant for older adults. Even worse, when prostate cancer is found, it is often a slow-growing type that would never have caused harm. However, some patients are then directed toward aggressive treatments like surgery or radiation. These treatments can cause serious, long-term side effects like incontinence, which is the inability to control urination, and erectile dysfunction, the inability to maintain an erection. In fact, a pivotal study published in the New England Journal of Medicine in 2012 followed over 180,000 men for 11 years. It found that routine PSA screening did not significantly reduce prostate cancer deaths in men over 70. In fact, it led to a 50% higher chance of being diagnosed with a cancer that never needed to be found, and a 30% higher chance of undergoing a treatment that reduced their quality of life without extending it. The U.S. Preventive Services Task Force currently recommends against PSA screening in men over 70. That's not because they want to ignore cancer, but because the harms of unnecessary diagnosis and treatment often outweigh the potential benefits. If an older man develops symptoms like difficulty urinating, blood in the urine, or unexplained bone pain, then testing makes sense. At that point, the test becomes part of a diagnostic process, not just a fishing expedition. One case report I reviewed involved a 74-year-old man who used to run a small hardware store. He felt completely fine, but decided to get his PSA tested after a friend was diagnosed with cancer. His result came back slightly elevated, so he was sent for a biopsy. The biopsy led to a diagnosis of low-risk prostate cancer, and he was quickly scheduled for surgery. After the operation, he lost bladder control and struggled with depression. 5 years later, his cancer still hadn't progressed and likely never would have. Instead of routine testing, older men should be guided by their symptoms and individual risk factors. You'll want to pay close attention now, because number 2 is a test that seems completely harmless but may cause the most silent damage of all. Number 2, routine electrocardiograms. The EKG is one of the most common heart tests performed in the world. It uses small electrodes attached to the skin to measure the electrical signals of the heart. The entire procedure takes less than 10 minutes and is completely painless. Because it's so easy to do, many doctors include it as part of a standard checkup, especially for seniors. But here's the truth most people never hear. When used as a routine test in someone without symptoms, especially over the age of 70, an EKG can become the start of a very dangerous path. That's because even tiny, harmless changes in heart rhythm or structure can appear on the results, especially in older hearts that have naturally aged over time. These minor blips are often labeled as abnormal, which then triggers a snowball effect. Suddenly, you're being sent for stress tests, echocardiograms, or even invasive angiograms, which are procedures that involve threading a thin tube into your heart through an artery. A massive study published in JAMA Internal Medicine in 2018 looked at 16,000 seniors who had routine EKGs without any symptoms. Within 6 months, over 10% of them underwent additional testing, and more than 1 in 50 ended up having a heart catheterization procedure that turned out to be completely unnecessary. Worse still, those who had invasive procedures had a 12% higher chance of being hospitalized with complications. The heart changes seen on EKGs in many seniors are often due to normal, age-related tissue stiffness or side effects from medication, not an underlying disease. When someone has chest pain, shortness of breath, or palpitations, an EKG is absolutely necessary. But doing it just to check a box can lead to surgeries that are not needed. There's a patient story I remember vividly from a medical review. She was a 79-year-old retired librarian who loved her gardening club. During a routine checkup, her doctor suggested an EKG. She had no symptoms, felt strong, and walked every single morning. The EKG showed something called nonspecific ST changes, which is a vague term often found in older patients. Her doctor grew concerned and ordered a treadmill stress test. When that came back inconclusive, she was sent for a heart catheterization. That procedure caused a complication that led to a brief heart attack, and she spent 2 weeks recovering in the hospital. All of it could have been avoided. The smarter approach is to only perform EKGs in seniors who are experiencing real symptoms or who are starting a new medication that might affect the heart. For general screening, focusing on blood pressure, cholesterol, and lifestyle provides much better predictive power. This leads us to number 1, the most unnecessary and potentially harmful test for people over 70. And yet, it's still included in so many annual exams. Number 1, routine chest X-rays. It's quick, it's painless, and for decades it was considered a staple of the annual physical. The routine chest X-ray is often offered to seniors during checkups, pre-surgery evaluations, or as part of a screening bundle, with the belief that it can catch early signs of lung problems or heart disease. But when it's done without specific symptoms or suspicion of disease, this test becomes not just useless but dangerous. Here's the shocking truth. Routine chest X-rays in asymptomatic people over 70 have one of the highest false positive rates among all imaging tests. That means the scan often picks up harmless findings, like old scarring, tiny nodules, or age-related changes in the lung tissue. But because any shadow on an X-ray can look ominous, even when it's not, doctors usually feel obligated to investigate further. What happens next can be a nightmare. That blurry spot on the X-ray turns into a CT scan, then maybe a PET scan, and then possibly a lung biopsy, which is a procedure that involves inserting a needle into the lung through the chest wall to collect a tissue sample. For seniors, this can be extremely risky. Lung biopsies carry a significant chance of complications, including a collapsed lung and serious infection. According to a 2021 study in the Annals of Internal Medicine, more than 35% of people over 70 who underwent lung biopsies for these incidental X-ray findings experienced a complication. Many of them required hospitalization or emergency interventions. Even more disturbing, over 85% of those biopsies revealed benign findings that required no treatment at all. The U.S. Preventive Services Task Force does not recommend routine chest X-rays for cancer screening or as part of general health exams. In fact, lung cancer screening is only recommended for very specific, high-risk individuals, such as those with a heavy smoking history. And even then, it's done with a low-dose CT scan, not a standard X-ray. One case that drives this point home involved an 80-year-old retired engineer who had never smoked, never had a cough, and was in great shape for his age. During a pre-op check for a hernia surgery, the hospital ordered a routine chest X-ray. It showed a small opacity in the upper lobe of his lung. The medical team panicked. They ordered more scans. A CT scan confirmed a tiny nodule. Even though it looked benign, the lung specialist recommended a biopsy, just to be safe. During the biopsy, his lung partially collapsed. He was hospitalized for 4 days with a chest tube inserted to re-inflate it. The nodule turned out to be an old, healed granuloma from a childhood infection. It had no relevance to his current health, but the process of finding it nearly cost him dearly. Routine chest X-rays offer no benefits in the absence of symptoms like a chronic cough, shortness of breath, or unexplained chest pain. In those cases, they can provide vital clues and help guide treatment, but using them as a fishing expedition in healthy seniors is not only unnecessary, it's dangerous. If the goal is to evaluate heart or lung function in an elderly person preparing for surgery, there are safer alternatives. A thorough clinical exam, a review of symptoms, and functional tests like walking assessments provide far more relevant data than a black and white image full of meaningless shadows. When it comes to detecting early disease, the answer isn't more radiation, it's smarter medicine. There you have it, 5 more tests that can do more harm than good if done routinely after age 70. Now you're probably wondering, what tests should I actually do after 70? Well, don't worry. We're working on a follow-up video revealing the 5 most important checkups every senior should never skip. So make sure you're subscribed with the notification bell turned on so you don't miss it. In the end, it's not that these 5 tests are inherently bad or should never be used. They can be life-saving in the right situations. But the key is context. Testing without symptoms or clear indications opens the door to false alarms, dangerous procedures, and a healthcare journey filled with stress instead of support. Modern medicine has made incredible progress, but with that progress has come a flood of unnecessary testing, especially in older adults who are more vulnerable to the domino effect of one small finding leading to a chain of dangerous decisions. It's a system sometimes built on fear, routine, and outdated thinking. But you have the power to ask smarter questions. You have the right to ask, why are we doing this test? You can ask, will this result change anything about my care plan? And if the answer is no, you can confidently make an informed decision. One of the most empowering things a senior can do is understand when testing helps and when it hurts. Because informed choices lead to better outcomes, a better quality of life, and more years lived in strength and peace. Now we want to hear from you. Have you ever had a medical test that led to more stress than answers? And do you feel more confident now in knowing which tests are truly necessary? Drop your story in the comments. We're reading and replying to everyone. And please, be sure to share this video with a loved one who might be unknowingly walking into medical traps they don't need. Thanks for watching.